In today's video, I'm going to talk about the best diet for type 2 diabetes, as that's still a highly debated topic. Let's look at the data together and end the debate so that we could focus on doing what actually works. I'll give you the exact results from studies showing how different diets affect HbA1c levels in type 2 diabetics. I'll compare 4 most commonly recommended diets for type 2 diabetics: the low-fat Mediterranean diet, the very low-fat vegan diet, the low-carb diet, and the low-carb keto diet. I will look into the scientific literature and give you an answer to the question, what is the best diet for type 2 diabetes? I will share an easy-to-understand comparison between these diets and show you the exact HbA1c glycated hemoglobin change so that you would know which diet to choose. I know most people don't read scientific papers. Even most doctors don't read it. We either don't have time for this or don't have the relevant scientific background to be able to find these studies, read them, and understand them. I'll present it in an easy-to-understand way. By the way, if you're new to my YouTube channel, my name is Greta, and I'm an online nutritionist and a holistic health coach. If you haven't yet, consider subscribing to my YouTube channel for weekly videos about insulin resistance, detox, diabetes, all the other chronic health conditions, and improving your overall health. So if you want to be healthy, you should definitely subscribe. And by the way, this is not a medical advice. My videos are for educational purposes only. Now, back to the best diet for type 2 diabetes. I'll compare the regular low-fat diet, also referred to as the Mediterranean diet, with around 45 to 50% calories from carbohydrates and 30-35% calories from fat. That's the regular recommendation for non-diabetics and diabetics. We can call it the Mediterranean diet that promotes whole grains, low-fat foods, unsaturated fats, fruits, veggies, lean meats, and so on. Then the next diet is the very low-fat vegan diet with more carbs, around 60 to 70% of calories coming from carbohydrates, and fat calories are closer to 20 or even 10% of the total calories. This diet focuses on removing all the animal products, which are naturally high in saturated fat and cholesterol. It usually promotes more fruits and veggies. So these two diets that I've just mentioned are both high in carbs and low in fat, but the vegan one is a lot lower in fat. Then the next diet is the low carbohydrate diet with less than 45% calories from carbs. It is higher in fat, but still is somewhat a moderate carb diet and moderate fat diet. This is quite broad, but your daily carbs could be anywhere between 70 to 150 grams of carbs a day. I would say this should be redefined to up to 100 grams of carbohydrates a day, or 10 to 20% of daily calories from carbohydrates. And the last diet is the low-carb ketogenic diet with 5 to 10% of calories from carbs and 60 or more % calories from fat. In grams, that would be something around 30 to 50 grams of carbohydrates a day. So that's the very low-carb diet. We will find out which narrative about type 2 diabetes is correct. Now, the first narrative says that excess fat causes type 2 diabetes, meaning reducing fat would be the best approach for managing type 2 diabetes. According to this narrative, the best diet for type 2 diabetes should be the one that is the lowest in fat, which is the very low-fat vegan diet. Then the next would be the regular low-fat diet, the Mediterranean type diet. Then the next one would be low-carb, higher fat diet. And the worst one would be the very low-carb, high-fat ketogenic diet. And then there's another narrative saying that excess carbohydrates, but not fat, cause type 2 diabetes. If this narrative is correct, the low-carb ketogenic diet would be the most effective for managing type 2 diabetes. The second one would be the simple low-carb diet. Then the Mediterranean low-fat diet. And the worst one would be the very low-fat vegan diet. The primary outcome that I will be looking at in these studies will be the change in HbA1c, your glycated hemoglobin levels. The hemoglobin A1C test tells you your average level of blood sugar over the past 2 to 3 months. Type 2 diabetes is classified as having HbA1c of 6.6 or more, while normal non-diabetic levels are less than 5.7%. The type 2 diabetes remission is classified as being able to achieve HbA1c of 6.4 or less. Some diabetics manage to achieve full remission, which is HbA1c of 5.7 or less. We will see how each diet makes someone with type 2 diabetes closer to these normal blood glucose levels. Also, at the end, I will share a study that compared the very low-fat, high-carb vegan diet with the regular low-fat diet and the very low-carb ketogenic diet and their effects on insulin levels. Because that's right, type 2 diabetes is not only about elevated blood glucose. It's a condition where you have elevated blood sugar and elevated insulin until the point it burns out and you have too little insulin. Majority of type 2 diabetics are insulin resistant. It's an important area to discuss. After watching this video, you will certainly know what is the best diet for type 2 diabetes, and you will be able to apply this knowledge to get the best possible results. There are people swearing that each one of these 4 diets is the best one for type 2 diabetes, but they can't all be the best. That's data that can be compared, and we can see clear results. And if we get the basics wrong, then there's no chance for preventing or successfully managing or even reversing this condition. We can clearly see that type 2 diabetes and obesity cases are growing, not shrinking, in the past years. We must have got something wrong here. I will discuss only the highest quality scientific evidence from randomized controlled trials, non-randomized trials, or systematic reviews, which will help us to answer the question, what is the best diet for type 2 diabetes? I see other YouTube doctors or nutritionists giving whatever dietary advice they like, while totally ignoring the research. When you look at all the research, it becomes pretty clear which diet is the best. If your doctor supports one of the diets that has poor results, please show him or her the reference list from this video so that you could update their knowledge and practices, as for some reason many of them are not up to date with the scientific literature, where they actually have a responsibility to constantly be checking it, to give their patients the best possible advice. People's lives depend on it, and doctors are seen as gods. All they say is correct. So please, feel free to share this research with your doctor if needed. Now let's look at the first diet, the Mediterranean diet for type 2 diabetes. The first study, Biologic and Quality of Life Outcomes from the Mediterranean Lifestyle Program, a randomized clinical trial. The study tested the effectiveness of the Mediterranean Lifestyle Program for reducing cardiovascular risk factors in postmenopausal women with type 2 diabetes. This Mediterranean Lifestyle Program involved following a Mediterranean low-saturated fat diet, stress management, exercise, group support, and help for quitting smoking. There were 279 type 2 diabetic women. They were divided into either usual care, which is control, or Mediterranean diet group, and they were followed for 6 months. And their results showed that the Mediterranean diet group had significantly greater improvements in HbA1c levels, BMI, plasma fatty acids, and quality of life at 6-month follow-up. HbA1c decreased from a beginning level of 7.43% to 7.07% at 6 months, a 0.4% reduction, while the control subjects stayed at 7.4%. After those 6 months, the total cholesterol, triglycerides, and LDL and HDL cholesterol did not achieve statistical significance between the groups. We will focus on the HbA1c change from 7.43% to 7.07% at 6 months, a 0.4% reduction. The results were not that high to begin with and decreased by 0.36%. As we see, participants did not achieve diabetes remission, only a very small improvement in HbA1c values. Then there's a meta-analysis, where we can see combined results from several studies. It's called Effects of the Mediterranean-Style Diet on Blood Sugar Control, Weight Loss and Cardiovascular Risk Factors among Type 2 Diabetes Individuals, a meta-analysis. Studies suggest that the Mediterranean-style diet may improve glucose metabolism in patients with type 2 diabetes, but the results are inconsistent. That's why they decided to create this meta-analysis of randomized controlled trials. Again, that's the highest quality evidence. They compared the Mediterranean diet with the control diet in patients with type 2 diabetes. The meta-analysis included 9 studies with 1,178 patients, and their results showed that compared with control diets, the Mediterranean diet decreased HbA1c more. Mean difference change compared to controls, minus 0.30. They don't state what was the average HbA1c level to begin with. So in this study, HbA1c decreased by minus 0.3 compared with controls. We don't know how meaningful is this change. Did it decrease from HbA1c, let's say 8% to 7.7%? We don't know. We will later compare these results with those from other diets. Now let's look at the second diet, the very low-fat vegan diet for type 2 diabetes. That's the title of the study, a low-fat vegan diet and a conventional diabetes diet in the treatment of type 2 diabetes, a randomized controlled 74-week clinical trial. That's also a very high-quality study and 1.5 years long. They start by saying that the low-fat vegetarian and vegan diets are associated with weight loss, increased insulin sensitivity, and improved cardiovascular health. They decided to compare the effects of the low-fat vegan diet and conventional diabetes diet and see how it affects blood glucose, weight, and lipid profile. So they're basically comparing the very low-fat vegan diet with the simple low-fat diet. So that's how they've made the study. There were 3 living individuals with type 2 diabetes, and 49 of them were assigned to a low-fat vegan diet, and the other 50 got assigned to following American Diabetes Association guidelines for 74 weeks. And every few weeks, and at the end of the trial, they checked their glycated hemoglobin, HbA1c, and plasma lipids, which are your blood fats. Here's what they found. Both groups lost 3 to 4 kilograms of weight, but there was no significant difference between the groups. At the end of the study, the vegan diet group had HbA1c change of minus 0.34, while the conventional diabetic diet group had a change of minus 0.14. Both diets were associated with sustained reduction in weight and plasma lipid concentrations. In an analysis controlling for medication changes, a low-fat vegan diet appeared to improve blood glucose and plasma lipids more than did the conventional diabetes diet recommendations. So the overall result of this study is reduction of HbA1c by minus 0.34. And if you compare the change between the groups, it's only 0.2 difference. Let's look at the third diet, the low-carb diet for type 2 diabetes. The title of the study, Effect of a 90 gram of carbs a day low-carbohydrate diet on blood sugar control and small LDL cholesterol in type 2 diabetes patients, an 18-month randomized controlled trial. It's a very high-quality study of 1.5 years. There were 92 poorly controlled type 2 diabetes patients aged 20 to 80 years with HbA1c of 7.5 or more. They were randomly assigned to a low-carb diet or traditional diabetic diet. The primary outcomes were blood glucose control status and change in medication effect score. The low-carb diet group consumed 88 grams of carbs a day on average, while the standard diabetic diet group consumed 151 grams of carbs a day on average, which is around twice as much when compared with the low-carb group. Let's see what they found. After those 18 months, the mean change in HbA1c from the start was statistically significant between the groups. HbA1c decreased by 1.6 in the low-carb group, compared with -1 for the regular diet group. That's HbA1c result of -1.6 in the low-carb group, and the difference between the groups is 0.6. 2-hour post-meal glucose decreased by -94 milligrams per deciliter in the low-carb group, compared with -18 milligrams per deciliter in the regular diabetic diet group. Medication use was decreased more in the low-carb group. They lost more weight, they lost more belly fat, so their waist measures were a lot smaller. They also had better blood pressure results, and all these were statistically significantly lower in the low-carb group. So the overall result of this study was HbA1c change from 7.5% or more to around 5.9%, and the change was 1.6. So far, that's the best result. People with poorly controlled diabetes are getting into pre-diabetic range. Pre-diabetic HbA1c range is 5.7 to 6.4%. 5.9 is very close to the normal non-diabetic range, and it is considered diabetes remission. And finally, let's look at the fourth diet, the very low-carb ketogenic diet for type 2 diabetes. The first study is called an online intervention comparing a very low-carbohydrate ketogenic diet and lifestyle recommendations versus a plate method diet in overweight individuals with type 2 diabetes, a randomized controlled trial. Their aim was to compare the very low-carbohydrate ketogenic diet with lifestyle changes, with a diet program based on American Diabetes Association's Create Your Plate, and see if it would improve blood glucose control and other health outcomes in overweight diabetics. Participants were 25 overweight adults with type 2 diabetes who had HbA1c levels between 6.5 to 9%, and the study was 32 weeks long, which is a bit more than 7 months. And their results showed that the keto diet group had better HbA1c improvements. On average, it decreased by minus 0.8% compared to the control group, minus 0.3%. So the difference between the groups was 0.5. More than half of participants in the keto diet group, 6 out of 11, lowered their HbA1c level to less than 6.5%, which is a pre-diabetic state or diabetes remission. And 0% of people in the control group managed to achieve it. Also, keto diet group lost 12.7 kilograms on average, compared to only 3 kilograms in the control group. Participants in the keto group lowered their triglyceride levels by minus 60.1 milligrams per deciliter on average, compared to only minus 6.2 milligrams per deciliter in the regular diabetic diet group, as some people got increased triglycerides on the low-fat diet. And there were way more people dropping out in the control group when compared to the keto group, meaning people found it easier to stick to keto. Then there's another trial, 90-day ketogenic diet in type 2 diabetics. 11 women who were recently diagnosed with type 2 diabetes with an average HbA1c of 8.9% followed a low-carb keto diet with 30 grams of carbs a day for 90 days. After 90 days, their average HbA1c was 5.6, which means most of participants achieved type 2 diabetes remission, like complete remission. And just to clarify, they were not using any diabetic medication, unlike in other studies. Only with the diet alone, they achieved type 2 diabetes remission, even reaching normal, non-diabetic results. And then there was a systematic review that is a summary of several experimental studies. It's called Efficacy of Ketogenic Diets on Type 2 Diabetes, a systematic review. They included 14 studies, out of which 12 were clinical trials. So these were the effects on glucose control. 10 out of 14 included studies showed a positive impact on HbA1c. In short-term studies, HbA1c improvements were variable, with reduction of 0.6% after 3 weeks to 0.9% decrease after 4 months, or even 1.3% HbA1c decrease after 32 weeks. So as we see, depending on the duration, we see different results. The longer someone follows this diet, the better results get. Now let's try to compare all the results of different diets. Mediterranean low-fat diet. The first trial, HbA1c change was from 7.43% to 7.07% at 6 months, 0.36 decrease from start to end, which is around 4.8% reduction. Diabetes remission was not achieved. Then the Mediterranean diet systematic review, HbA1c change minus 0.3 points compared between both groups. Let's say one reduced 7.4 to 7.1, while the control stayed at 7.4. That's a change of 0.3 between the two groups. Let's move to the next diet, the very low-fat vegan diet, a 74-week randomized controlled trial, reduction of HbA1c by minus 0.34. HbA1c changed from 8.05% to 7.71%, which is percentage-wise minus 4.22% reduction. Diabetes remission was not achieved. They reached 7.71% HbA1c. Then let's look at the next diet, the low-carb diet, 18-month randomized controlled trial. HbA1c changed from 7.5% or more to around 5.9%. The change was minus 1.6, which is 21% reduction. Diabetes remission was achieved, but the results could be further improved to achieve complete diabetes remission. Then let's look at the very low-carb keto diet, a 32-week keto trial. HbA1c change minus 0.8%, went from 7.1 to 6.3%, which is 11.3% reduction. Type 2 diabetes remission achieved. Now, that's more than the vegan diet, more than the Mediterranean diet, but less than the low-carb diet. But as we see, the low-carb diet trial was 18 months, while this keto diet trial was only 7 months. Then the next keto 90-day trial, HbA1c went from 8.9% to 5.6%, which is 3.3% less in HbA1c scores. That is the best result so far. That's a reduction by 37%. And it was a very short trial, only 3 months. A trial where no medication was used, so that's pretty impressive. And then the final keto systematic review, HbA1c change minus 0.6 after 3 weeks, minus 0.9 after 4 months, minus 1.3 after 32 weeks, which is 7 months. So as we see, there were a lot of variations between these studies. They had different durations, different number of participants, different HbA1c values to begin with. Some studies use participants who take diabetic medication, some who don't use any medication. Some express their results in mean change values without providing average HbA1c values. It's a total mess, but here's what we can see for certain. The low-fat Mediterranean diet and the very low-fat vegan diet both had very similar results. HbA1c change of around minus 0.3. The vegan diet was a tiny bit better, minus 0.34%, while the lower carbohydrate diets were a lot better, especially the 30 grams of carbohydrates a day keto, where people achieved complete diabetes remission, reached non-diabetic blood glucose levels without medication. And don't be tricked by the fact that there are way more studies conducted on the Mediterranean diet, and that studies are bigger, when compared to the keto diet that has only a few trials. It simply shows that those who have the money for funding studies prefer to fund the Mediterranean low-fat diet studies. They want this diet to dominate the space. Why? Maybe they are not searching for the best diet for type 2 diabetes. Well, I helped you to find the answer. So now we know that the low-carb diet and the low-carb keto diet are the best diets for reducing your daily glucose and your HbA1c levels. Now, a lot of people would still say, it's still bad for you. A high-fat diet increases insulin and causes insulin resistance. Let's quickly have a look if that's true. Are there any studies looking at how the low-carb, high-fat ketogenic diet compared to a higher-carb, low-fat diet affects insulin levels and insulin resistance? There's a study called Comparison of Isocaloric, Very Low Carbohydrate, High Saturated Fat and High Carbohydrate, Low Saturated Fat Diets on Body Composition and Cardiovascular Risk. They compared 3 different diets and measured insulin levels. There were 83 subjects. They were randomly allocated to one of 3 weight loss diets with the same number of calories for 8 weeks and on the same diets in energy balance for 4 weeks. The first diet was a very low-fat, high-carb diet with these macros: carbs, 70% of calories, fat, 10% of calories, protein, 20% of calories, marked in orange. The second high-carb diet was a high unsaturated fat, high-carb diet with macros as follows: 50% carbs, 30% fat, 20% protein, and 6% of fat was saturated fat. That's your Mediterranean diet, marked in red. And the third diet was a very low-carb, high-fat ketogenic diet with macros as follows: 4% carbs, 61% fat, 35% protein, 20% of the fat was saturated fat, marked in green. So if saturated fat is the problem, this diet should cause the most insulin and result in insulin resistance, because too much insulin causes insulin resistance. It's same if you eat too much chocolate and ice cream and you feel sick. You've had too much of it and you don't want it anymore. That's basically insulin resistance. Looking at the results, we see that the very low-fat, very high-carb diet, marked in orange, resulted in the highest levels of insulin. The more carbs you eat, the more insulin you need to bring it to the cells. And we see that the high-fat, low-carb keto diet, marked in green, resulted in the lowest levels of insulin. The less carbs you eat, the less insulin you need, and the less insulin resistant you become. This clearly shows that the high-fat, high-saturated fat diet has nothing to do with causing insulin resistance. It helps you to lower insulin and reverse insulin resistance. And if you need more proof, I have a whole separate video looking into the cause of insulin resistance. You can watch it later. Now, if you found this video useful, like it and subscribe to my YouTube channel, and share it with someone who has type 2 diabetes. And also share it with your doctor if he or she doesn't follow the most effective practices for managing type 2 diabetes. Why would you follow a diet that keeps you in a diabetic range, taking diabetic medication, if you can follow a diet that makes your blood glucose normal, in some cases without any medication? Feel free to join my type 2 diabetes support group on Facebook, get my type 2 diabetes meal plan, or join my type 2 diabetes coaching program if you need help for achieving diabetes remission. Thanks so much for watching, and I hope to see you in the next video.